conduct a delivery. Okay, when you conduct a delivery, like I said, there should be masterly inactivity. So you don't do anything until the baby is being born. When you have a breech down for delivery, you should have a senior obstetrician, you should have an anesthetist, you should have a pediatrician, because you must have all the help. Suddenly you might require anesthesia, so you must have all the help. Baby might be born asphyxiated, so a pediatrician should be there. There are certain landmarks that you must know. If you know these landmarks, you will know when to conduct the various stages, because the delivery is occurring in 3 stages: buttock, delivery of the shoulders, and delivery of the head. Now, as soon as the anus is seen, okay, so we must remember not to encourage the patient to strain. The baby should be delivered by its own effort, and as far as possible, do not give her an oxytocin unless really indicated. As soon as the anus is seen, that is the time when you ask the patient to come to the edge of the table and you get ready to conduct the delivery. If a epidural has not been given, you can start infiltration. Once the breech starts to climb the perineum, that is when you give her a medial lateral episiotomy. Now, this episiotomy is important for all breeches because you may be required to do some maneuvers. So, it's important that you give her an episiotomy. Now, you wait until the breech delivers by its mother's own efforts till the umbilicus. Now, once the baby is being born till the umbilicus, then if there is a loop of cord, you keep it aside. This is the time when you start to intervene. Now you start and hold the babies. Now the way you hold the baby should be in the femoral grip. So the two fingers, thumb is placed over the sacrum and your index finger over the iliac crest. Now hold the baby like this. Do not hold the baby over the abdomen because it might cause a pressure and injury to the abdominal structure. So hold the baby like this. This is called as a femoral grip. And always make it a point and ensure that the back of the baby is facing you. That is very, very important. You don't want the back to be posterior. So rotate the baby in such a way the baby's back is facing you. Now at this time, the time from now on until the delivery should be only around 2 to 3 minutes. That does not mean you hasten the delivery. You allow the baby, give it enough time to do all the maneuvers. Now, it's important that you don't apply traction, because when you apply traction, what is happening is there's going to be an extension and the baby's head might get extended. You don't want that to happen. In addition, there could be extension of the arms or nuchal position of the arms. So, allow gentle traction. The basic thing should be always you promote flexion. Now, you continue little bit of force and then the baby is being borne down. Now once the scapula is seen, then that is the time for you to deliver the shoulders. Okay, so once the axle is seen, you could deliver the shoulders in 2 ways. You just rotate the baby slightly like this and then the shoulders will be seen, the anterior shoulder falls down and you could deliver. The other way is you just rotate the babies like this. See, now you are able to see the posterior shoulder which is coming down the pubic symphysis. You just put a hand, hook out the arm with your finger. Okay, so both the shoulders are being delivered. Now you allow the breech to hang. Now you don't allow it to hang by itself because by doing this it can cause extension. So you just support the baby. You allow it to hang down for at least a few seconds. And then once the nape of the neck is seen, that is the time for you to deliver the head. Now when you deliver the head, there are certain factors that you must take into consideration. One is you must see that always you promote flexion by asking your assistant to give suprapubic pressure. That is one. You must see that the rapid emergence of the head does not happen, because if the head delivers rapidly, there is going to be a tentorial tear and intracranial hemorrhage. So that should be prevented. And don't use too much of traction. This sort of traction should not be done. So when you go on applying traction, what can happen is there could be an increased chance of brachial injuries. Those 3 steps should be kept in mind. So what you do is you don't deliver the head until the nape of the neck is seen. All these are very, very important landmarks that all of us should know. So once the nape of the neck is seen, you ask a assistant to apply suprapubic pressure. There are 3 methods in which you can deliver the baby. One is the commonly used method is your Marshall-Burns technique. So Marshall-Burns technique, with your right hand, you hold the baby's feet, and then when your assistant is applying suprapubic pressure, you just arc the baby over the mother's abdomen and the baby is being born. That is the commonest method that all of us use. The second method is your Marshall-Smellie-Wyatt technique. For this, you put the baby astride your left forearm and then 2 fingers are kept over your index finger and the middle finger are kept over the maxilla, and with your right hand, the middle finger is kept over the occiput and the thumb and the ring finger is placed over the clavicle. Now what happens is the occiput finger and the two fingers of the maxilla are promoting flexion, and the two fingers of the clavicle is preventing any cervical injuries, because all these are common things. So now when the baby is like this, you promote flexion and the baby is being delivered. That's how you do. Now for a forceps delivery, what you do is you ask your assistant to hold the baby up like this, and then you ask your assistant to cover the baby with a towel. Don't hyper extend the baby like this. You ask the baby to hold it with a towel.